What are common emotional stages after a cancer diagnosis? Being diagnosed with cancer can be a life-altering experience that triggers a range of emotional responses. Understanding these common emotional stages can help both patients and their loved ones navigate this challenging journey. The first stage many people encounter is shock and denial. This reaction is often characterized by disbelief and a sense of numbness. Patients may struggle to accept their diagnosis, feeling detached from reality. Denial can serve as a temporary coping mechanism, allowing individuals to process the overwhelming news at their own pace. For instance, someone might downplay their symptoms or avoid discussing treatment options initially. As the reality of the diagnosis sets in, fear and anxiety frequently emerge. Patients may find themselves worrying about the disease's progression, potential side effects of treatment, and how their lives will change. This stage can bring intense emotional distress, including fears about death or disability, which can be quite overwhelming. Next comes anger and frustration. It is common for patients to feel anger directed at the illness itself, the perceived unfairness of their situation, or even at healthcare providers and family members. This anger may stem from the limitations cancer imposes on daily life and independence. Some may internalize this anger, leading to irritability and resentment. Many patients also experience sadness and depression as they grapple with their diagnosis. Feelings of grief can arise from the loss of health, changes in body image, and uncertainty about the future. Depression is a recognized condition in cancer patients and may require professional support to address effectively. Over time, many individuals reach a stage of acceptance and adjustment. Acceptance does not mean giving up hope. Rather, it involves integrating the diagnosis into their lives and focusing on treatment and quality of life. This stage can foster resilience and motivate patients to engage actively in their care. Alongside acceptance, a fighting spirit or renewed hope often develops. Patients may begin to set goals, seek information, and collaborate with healthcare teams to manage their disease. A positive outlook can significantly enhance emotional well-being and coping strategies. For those diagnosed with bone cancer, emotional responses can be uniquely affected due to the disease's impact on mobility and independence. Patients may face additional challenges, such as chronic pain and increased dependence on caregivers, which can heighten feelings of frustration and sadness. Maintaining independence becomes a vital emotional need for many. Emotional support from healthcare providers, counselors, and support groups is essential throughout all stages of this journey. Open communication with family and care teams can help patients express their feelings and receive reassurance. Psychological interventions, such as cognitive behavioral therapy and stress management techniques, can also alleviate anxiety and depression. Encouraging patients to maintain routines and independence, when possible, is crucial for their emotional well-being. In summary, the emotional stages after a cancer diagnosis typically include shock and denial, fear and anxiety, anger, sadness, acceptance, and hope. Each person's experience is unique, and these stages may overlap or recur. Recognizing these emotional responses can help patients, families, and healthcare providers address psychological needs alongside physical treatment.